Welcome to this Meducate lecture on cystic fibrosis. Today we'll be talking about the disease cystic fibrosis. Cystic fibrosis is an autosomal recessive disorder, which means it requires two alleles, one from the maternal, the other the paternal DNA, in order to get the phenotypic expression in individuals. The phenotypic expression of the faulty alleles results in mutation in the CFTR protein. The CFTR protein is a channel protein that controls the flow of water and chloride ions in and out of cells. When the CFTR protein is working correctly, as seen on the left, ions flow freely in and out of the cells. However, when the CFTR protein is malfunctioning, these ions cannot flow out of the cells due to the channel being blocked. CFTR is crucial in the body. It is involved in the production of various secretions, including sweat, mucus, and digestive fluids. Mutations cause the secretions to become thickened. Here we are looking at a transverse slice of the trachea. Shows the comparison between an unaffected individual and an individual suffering with CF. You can see the mucus has become thickened, and from this you may begin to hypothesize how this may affect the respiratory system. CF affects several organs, including the lungs, the sinuses, and the gastrointestinal system. In addition, it also affects the reproductive system. We will now consider these individually. Let's consider the effect on the lungs. As described earlier, the faulty CFTR protein causes mucus to thicken. This now thick mucus is unable to be cleared effectively by the physiological mechanisms in place, mainly the mucociliary escalator. The chronic presence of thick mucus irritates the airways and causes inflammation. This also creates an ideal environment for bacteria to thrive. This can eventually lead to pneumonia. Recurrent infections of the lungs lead to bronchiectasis, which are permanent enlargement of the alveoli. Early signs are a productive cough, and also reduction in ability to exercise. Commonest organisms affecting CF patients are Pseudomonas aeruginosa, Staphylococcus aureus, and Haemophilus influenza. People with CF also develop bronchopulmonary aspergillosis and are also at risk of being infected by Mycobacterium avium. Mucus can also thicken in the paranasal sinuses. This now thickened mucus is unable to be drained appropriately. As a result, the mucosa becomes inflamed. This results in facial pain, fever, and headaches. Chronic sinusitis results in the formation of polyps. Now let's consider the gastrointestinal system. CF effects on the GI system can be simplified to those affecting the pancreas, small intestine, and liver. We will now consider these organs individually. The mucus in the pancreas thickens. This results in the exocrine secretions being unable to move to the duodenum via the ampulla vata, which results in retrograde flow of digestive juices, which leads to cell catabolism of the pancreas. This leads to pancreatitis. Eventually, cystic changes occur within the pancreas, which gives rise to the disorder being called cystic fibrosis. The lack of digestive enzymes in the duodenum leads to malabsorption. This can affect the growth and development of the individual. Individuals with CF also have difficulties absorbing fat-soluble vitamins, which include A, D, E, and K. The liver is also affected as the bile thickens. The thickened bile cannot flow via the hepatobiliary tree to the duodenum. Thus, retrograde flow of bile to the liver results in hepatitis. This has detrimental effect on the liver and liver function, mainly including synthesis of proteins in the liver. As a result, clotting abnormalities occur. We have now considered how cystic fibrosis affects the various organs. The main symptoms can be summarized as the following: salty tasting skin, poor growth, poor weight gain, accumulation of mucus in the chest causing cough and recurrent infections. Earlier signs, however, in the newborn is something called meconium ileus. Meconium is the first stool that the newborn passes. However, in CF, this is too sticky and too mucousy. As a result, it causes obstruction. This is a surgical emergency. In rare cases in kids, CF manifests as clotting disorders or unexplained bruising. This is because in CF, vitamin K absorption is impaired. Young kids are particularly sensitive to the impairment of vitamin K as a result of the disease's effect on the liver. The main diagnosis of CF is to do a sweat test, and what you would expect to find is raised chloride.